Welcome back. In this next interview, we're focusing on two common but often misunderstood conditions: osteoarthritis and rheumatoid arthritis. Many people think arthritis is simply joint pain, but the truth is far deeper, ranging from degenerative changes to autoimmune attacks on the joints. Understanding the differences and spotting the early warning signs can make treatment far more effective. To help us break this down, I'm being joined by two amazing pharmacists. Talking about pharmacist Amenze Gabo and pharmacist Francisca Mwejike. Thank you for joining us this morning. Good morning to you.
Good morning.
Okay, so let me begin with you, pharmacist Mwejike. What exactly is arthritis and how does it differ from other forms of joint pain?
Arthritis is a broad term used to describe a whole lot of disorders that affect the bones and the joints. So it's like broad. We have over 100 types of arthritis. It's just a general term for.
So anything that has to do with joint pain, we just say arthritis.
Yeah, a general term for all bone disorders. And like we are going to discuss today, the two most common ones are the osteoarthritis and the rheumatoid arthritis.
Okay, so let me come to you, pharmacist Igebo. Now, when you say she's saying that arthritis is general joint pain, incidentally, I think it was 2 days ago, or it was yesterday, I woke up and I was having pain on my knee. So when my producer sent me the topic, I was smiling. I was like, let me come and find out. Free consultation, let me find out what's happening to me. So that I have a pain at my knee joint now, does that mean it's arthritis?
Well, it does not necessarily mean it's arthritis because you have a pain in your joint. Arthritis has to do with so many symptoms, and sometimes it might also be like a warning sign. You understand? That pain there might be as a result of maybe trauma or maybe you hit your feet or something. Or not. But when it comes to arthritis, there are so many symptoms involved before you can say this is arthritis.
Okay.
And one of those symptoms is when you feel tenderness around your joints when you touch it. And also another symptom is, of course, that pain. And when you move your knee, like you said, if you move your knee, you normally have a range. You normally have, okay, the extent when you flex your knee, it gets to a very maybe long range. But if you have arthritis, you may not be able to move that knee to the normal range. And also, at times, when you wake up in the morning, you see, or when you're at rest, you're not doing anything. When you start, maybe try to stand up, you have this stiffness. You don't find it very difficult to move your leg. And sometimes it lasts for like 30 minutes, sometimes 1 hour.
Oh, stiffness.
Yes.
Interesting.
Yes.
Okay, so back to you, pharmacist Mwejike. Can you briefly draw the line for us, the difference between osteoarthritis and rheumatoid arthritis in simple terms, please?
Okay, he has gone around it a bit. The main difference, so rheumatoid arthritis is an autoimmune inflammatory condition. I'm going to explain before you tell me everything. So it's an autoimmune meaning that the body attacks its own cells. This time around, the cells around the joint. Yes, it attacks these cells and degenerates, breaks it down. So while osteoarthritis, okay, let me just briefly talk about osteoarthritis. It happens mainly in the advanced people,
Okay.
in people over 50 years of age, and it has to do with the wearing and tearing of the cartilage around the joint. Let me explain. So the cartilage is a tissue that helps with the joining of two bones, two large bones at the joint. A joint is a place where two large bones meet, like the knee, the elbow. So in osteoarthritis, this tissue that joins the two bones breaks down. And so you can imagine two metals, the way you grease two metals so that when they are touching each other, there's no friction. That's what the cartilage does. So if it is broken off, it means that the two bones are touching themselves directly, which can cause friction and pain and inflammation that comes, discomfort that comes with it. So that's like the major difference between osteoarthritis is not autoimmune. It just happens due to the breakdown.
Rheumatoid is autoimmune. So,
Yes, rheumatoid is.
Pharmacist Ige, but let's pick up from where she stopped. Osteoarthritis. So, what are the major causes and risk factors associated with it? Now, she talked about age.
Yeah.
So, what other risk factors and causes?
Okay, for osteoarthritis, like you said, she talked about age. That's just one risk factor. Obesity is also a risk factor when you're overweight. And you know, when you're overweight, you exert so much weight on your knees, your hips, and those are areas where you have joints that can be affected by osteoarthritis. And also, there's also another risk factor. If you are a smoker,
Really?
yeah, smoking is associated with osteoarthritis. And another gender, women. Studies are shown.
It plagues women more.
Yes.
Why? Is there any scientific backing, or just statistics shows that it affects women more?
Statistics and studies, but it has not really been like proven the main cause. Maybe over time, it has been noticed that women are more prone to osteoarthritis. Women above the age of 50 most times, they are prone to osteoarthritis. And lifestyle too, like I said, smoking, your health, your eating habits, too much, and also it has been proven too that fatty diets and fat deposition in your body can also produce proteins that affect your joints. So those ones they are quite deep, but I don't think so that's it.
All right, so, madam, to you, for rheumatoid arthritis, since it's an autoimmune condition, like you stated, what triggers it, and who is most at risk?
Okay, like I said earlier, there is no particular known cause of rheumatoid arthritis. It just happens all of a sudden, like the body just sees the tissues, the cells of the joint as an enemy, if I may use the term. So it starts to fight it.
So there's no scientifically proven trigger that could have led to?
No.
Okay.
Although, while trying to, like he said, while trying to find the possible causes, it could be genetic or environmental. Genetic being that your family has it, and then environmental from smoking, unhealthy lifestyle activities. I'm sorry, let me deviate a bit. I remembered something. So as much as there is no known cause of osteoarthritis in women, why it is more common in women, a woman's body is very complex. Like there are a whole lot of hormones in the body, and these hormones it's like a cycle. Like when one is faulty, when something is wrong, every other part of the body goes haywire. So if estrogen, for instance, is low, like in menopausal women, every other part of the body is affected. So that's like one huge factor that makes women more prone to having arthritis. And I also wanted to mention that another major difference between osteoarthritis and rheumatoid arthritis is that rheumatoid arthritis can happen at any part of the body, not just the legs, the hands. It could happen at your lungs.
Joints.
Your
lungs.
Okay,
you're saying apart from joints, rheumatoid can happen.
Yes,
Yeah.
your lungs, the heart, any part of the body at all. It's just an inflammation of that part of the body due to this autoimmune trigger.
Okay. Now, for rheumatoid arthritis that she spoke about now, that was a very great enlightenment. What early warning signs distinguish it from normal body aches?
Okay. Before I get into that, I would like you to know that rheumatoid arthritis comes in 4 stages.
Okay.
And the symptoms. So the first stage is usually inflammation.
Okay.
Must have heard of inflammation before. So in this first stage, you see this inflammation, like there's inflammation around the tissue surrounding these joints, and there you may not see any physical damage to the knee or anything, or maybe the ankle or anywhere the joint is, but you just notice there's inflammation there, and there's little pain and stiffness of the joint. Well, when it gets to stage 2, and stage 2, this inflammation starts affecting the joint, the tissues, the cartilages in the joints. You know, the cartilages, like you said earlier, are what like protect your bones from rubbing against each other. So this inflammation starts affecting the joints, and from there you get more more joint stiffness and pain. Then you go to stage 3. Stage 3, now the inflammation has gone so severe, it affects your bones. Right now you start seeing severe pain, and stiffness is even more severe. And so you see when you touch the joints, they are tender. In the first stage, there's no more inflammation. There's no inflammation, but the joints are just getting worse. That in that stage, it can affect how you move your joints, and it may even make you immobile. You can never move without support. So those are like the 4 healthy stages of rheumatoid arthritis.
Okay. Pharmacist, where you can. At what point should someone seek medical attention instead of attributing it to normal pain or aging or stress?
As soon as you notice a consistent discomfort, like
What's
the
the definition
pain.
of consistent? Mine started yesterday.
Okay, yesterday it's too soon. It's too soon to.
So I can
you
give it
could
like
stop.
a week.
Yes, or a month. It can be starting. It can start and stop, and then most times with rheumatoid arthritis, it doesn't just happen on one side of the body. It is symmetric. Like it happens on both sides at the same level. So it
Oh,
could be
wow.
both your knees or your ribs, the both sides, or your 2 elbows.
Oh,
So-
wow, interesting. It comes as a twin.
Yes. So once you notice these signs consistently, or you have fever alongside the pains on your joints or your body, you should just go and get checked up. And then for people who are advanced in age, over 50 years, once they start noticing pains, of course, in their joints, their knees, their elbows, most times it's their knees and their hips. So you should just go and get it checked.
So how are these conditions diagnosed? Blood tests, scans, physical examination. When someone gets to the hospital,
Okay,
what should be expected?
you just said that. See, you basically said everything. It's like you've done your research. Yes, that depends on the medical practitioner, or their X-rays done, scans, like you said, and everything. And physical examination, of course. But sometimes, like the early stages, the pain may just be there. It's like what you're asking. I'm not saying you have that.
No, I don't have it.
See, the pain might just be there, and you cannot really tell. Like the first stage of rheumatoid arthritis, like I said, I mentioned earlier. If you go for an X-ray, or if the doctor order an X-ray, you might never see any damage to that joint.
But the pain
But
is there
the pain
already.
there. And it might need to, like she said, it goes and comes. So it depends on your medical practitioner. But there are X-rays done, in some cases, blood tests, and in some cases, physical examination. It depends on your medical practitioner.
Okay, I would love any of you to jump on these. Are there common myths associated to arthritis that you would like to debunk or you like to correct? Anyone comes to mind?
Yeah, arthritis is from the village, like
Village people.
village people. Arthritis is from them, and arthritis is treatable. So stop running from place to place looking for a permanent treatment for arthritis. It is not curable.
It's managed. You just
Yeah,
manage.
it's just managed. For osteoarthritis, it is managed. They might give you painkillers, something for inflammation, and then you'll be asked to watch your lifestyle, not to lift so much weight and reduce stress. And then for rheumatoid arthritis, you'll also be managed. There's no permanent cure for arthritis. And then you'll be asked to lose weight too, very important for osteoarthritis.
So do you have any to add? Then is it compulsory that as long as you are getting old, at least osteoarthritis must touch you?
Okay.
You must go down with it.
Thank you very much for that question. Expert studies have observed that 80% of people above the age of 55 have
They go down with
osteoarthritis.
Even
Just-
athletes, people that
Exactly, I'm coming there. 80% of people that are above 55 years have osteoarthritis. even though some persons having it might not experience those symptoms, or they might not notice those symptoms, but 60% of people that have osteoarthritis will feel it. So old age is a major factor. So as far as you are getting old, like osteoarthritis, it comes from wear and tear or overuse of that joint. So
but science can be funny. Only science will advise us don't indulge in sedentary lifestyle. Now, you're telling me that overuse, wear and tear can lead to. So, which should we choose now? If you are active, you say balance.
yes,
Just maintain a healthy lifestyle from when you're young. Don't wait till you are old or you're getting old before you start doing the things you need to do. Check your blood sugar. That people who are diabetic, make sure it is well controlled. Try to not be overweight. Eat healthy, and start from when you're young. Don't wait till you're advanced in age to start observing all of these things.
So, as a pharmacist, are there medications or therapies that a pharmacist would commonly recommend in managing these conditions? You don't have to name them, I just want to be sure if there are medications that specifically handle this.
of course, that's why we are pharmacists. There are medications for osteoarthritis, rheumatoid arthritis, like she said earlier, painkillers, and some other medications that if I mention, you might know.
Okay. So, pharmacists, are there maybe people that indulge in self-medication? Are there drugs that they can take that might aggravate such condition without knowing? So, for example, now, a pregnant lady, there are some things that some drugs she should not take. Yes. Then now, are we saying yes, a patient that has arthritis, be it osteoarthritis or rheumatoid arthritis, are there products, are there drugs that the person can take that might worsen the condition?
Not directly worsening the situation, because most painkillers will just suppress the pain temporarily, right? And the thing is that you might be taking care of the pain at that moment, since I said there's no treatment, but you'll be causing another issue for yourself, because the NSAIDs, let me mention, like ibuprofen, diclofenac, when abused, can cause ulcer. So the safest that anybody can take is paracetamol. And even the paracetamol, you're not meant to take it for more than 3 days in a row, because it can cause damages to your organs. So what I'm trying to say is that as much as possible, don't self-medicate. If you have any issues, any challenges, there are pharmacies around you. You can just go into one and be guided properly for free. So you don't have to endanger yourself. Yeah, unless if you are, the consultations are unless if they have to give you medicines, that's when you pay. And then there are, aside the painkillers, there are some supplements that can help with your nerve function, your bone function. So all of those things are just supportive therapy. There is no permanent treatment for rheumatoid arthritis, and don't self-medicate, please.
Okay, so even as we begin to wind down, pharmacist again, but from your experience, now she was talking about free consultancy, I don't know about that, but from your experience, do Nigerians often seek treatment early? Like, do they notice early? Do they come to the pharmacy early enough to say, okay, I'm feeling this pain and what should I do? Or it's when it has gotten severe that most persons come to the pharmacy?
Okay.
From your experience, I'm not saying statistically. From
experience,
I'm not saying
experience as a pharmacist. Notice that most persons that come to the pharmacy or to the hospital and get diagnosed of rheumatoid or osteoarthritis, they usually come when the pain has gotten unbearable. Like I said, this thing takes time. Sometimes it takes years before it gets to that stage where it might start affecting your mobility. So people decide, oh yeah, maybe not just small pain, or maybe it's just a small pain, or just take paracetamol. They ignore the healthy lifestyle. They ignore their regular exercise. Some, like I said, smoking affects or it's a risk factor. They just in Nigeria or in this part of the world that we're in, until the thing gets worse or it gets to a point where we cannot take it anymore, that's when we come to it. So from my experience, people tend to come late to the hospital, come late to the pharmacy. By that time, or just to slow down the progression of the condition. So that's it. So we are imploring people to start observing these minute signs, these symptoms of pain here or what. That's why we're here, to sensitize them so that they know that the earlier the better. So when you notice these things sometime, you come to the pharmacy, you go to the hospital, then we can start tackling it. Like I said, it's manageable, but there's no cure.
So I like that, it's manageable. So pharmacists, what advice do you have for people who have elderly parents or relatives and they are watching over them, people that are living with arthritis, that family members are watching over? What advice do you have for them?
So we've literally said almost everything. There's nothing I'll say that is new. Just try to help them maintain healthy lifestyle. As much as possible, they should reduce their weight and make sure they check their blood sugar from time to time, their blood pressure, and have their regular checks done as at when due. And you also yourself, don't just be caring for them. You should also watch out for yourself too. If you notice anything that is unusual, no matter how little, just the way you would go to check your car parts, if anything goes wrong or you hear any kind of sound, your health, your body, I keep saying it, your body is the most important asset that you have. So if you notice anything that is unusual, you should just go to get it checked.
Do you have anything to say?
I'd like to add that osteoarthritis can also be caused by, like, for example, you're into sports like football, like those sport activities that exposes your joints to
Excessive
trauma.
use.
Yeah, excessive use and maybe injuries. Road accidents can also lead to osteoarthritis. If you have injuries to those joints over time, it can result in osteoarthritis. So whenever, if you are involved in sports activities, use protective gears to protect. There are knee braces too that you can use to protect your knees. And then also, maybe you are a driver, it's advisable to use your seat belts to avoid any trauma to your joints. So basically, live a healthy lifestyle. Or when you observe any pain, go and see your doctor on time. Don't wait till it's getting overboard before you come. So that's it basically.
Alright, thank you very much, Pharmacist Ejike and Pharmacist Igebo, for sharing your valuable knowledge with us. And I believe that the viewer out there has gotten knowledge on how and the need, first of all, on how to recognize the early symptoms and the need to seek early medical care. We do appreciate you for your time, for joining us on the ride this morning. We'll go for a break, and when we return, we'll take our last interview for the day. Please stay tuned.